pain. It protects us, warns us, and teaches us. But what if you couldn't feel it at all? What if your body stayed silent, even when it was hurt? In just 5 minutes, we're diving into the strange, fascinating world of pain. What it is, how it works, and what happens when it's gone. Are there people who don't feel pain? Yes, this is known as hereditary sensory and autonomic neuropathy, a hereditary nerve disorder. In fact, only 1 in 250,000 people experience this condition. Feeling pain is an important mechanism for the body's self-protection, as pain keeps us from harm. But for some, not feeling pain can make life dangerous. These individuals may walk with a broken leg, burn their hands on a hot cup of tea, and sometimes go through infections without even noticing. So, how do we react when we feel pain? How do we perceive it? How does our brain perceive pain? When we touch something hot, like a flame, our body quickly sends a pain signal. This signal travels from the finger to the spinal cord and then to the brain. The brain interprets this as pain, but attention can change how we feel pain. If we focus on something else, we might feel less pain. The brain responds to factors that direct our attention, influencing how we perceive pain. This experiment was conducted while being monitored with fMRI. The participants were divided into 2 groups of 10 people each. The first group was given a simple attention test, while the second group underwent a more challenging attention test. Both groups were subjected to a 47 degrees Celsius hot plate. However, the first group felt pain when coming into contact with the plate, while the second group did not feel pain. This demonstrates the relationship between attention and pain perception. In the second experiment, attention tests were removed, and this time, the second group also began to feel pain. This result highlights the significant impact of attention on how we perceive pain. Painkillers play a significant role in pain management. But what types of painkillers are used? There are 3 main categories: NSAIDs, non-steroidal anti-inflammatory drugs, paracetamol, and opiates. NSAIDs work by reducing inflammation, which in turn alleviates pain. They are effective for a wide range of pain, from headaches to muscle aches. Acetylsalicylic acid, aspirin, and ibuprofen are common examples. Paracetamol, on the other hand, directly targets pain but has little to no effect on inflammation. It is commonly used for mild pain, such as headaches, toothaches, or muscle soreness. Opiates are among the strongest painkillers and are typically used after surgeries, for severe injuries, or for cancer pain. Morphine and codeine are part of this group. However, opiates come with a risk of addiction, so they should be used carefully. Acute pain is usually caused by tissue damage, like a cut finger or a broken bone. Its source is clear. Chronic pain, however, often has no obvious cause. Not every pain is tied to a physical injury. Acute pain works as a warning system. It alerts you to damage and pushes you to take action. In chronic pain, this warning function is lost. There's no clear threat, yet the pain persists. Acute pain lasts as long as your body needs to heal, typically no more than 3 to 6 months. If pain continues beyond that period, it's generally considered chronic. Acute pain usually fades as recovery progresses. Chronic pain, on the other hand, can be emotionally exhausting, often leading to stress and a sense of hopelessness. Depending on its severity, acute pain is treated with painkillers or anti-inflammatory drugs. But chronic pain often doesn't respond well to medication. Instead, treatment focuses on pain management and improving life quality. Who can endure pain better, men or women? A study conducted in 2012 showed that men are slightly better at handling pain than women. This difference can be seen even when both men and women are exposed to the same pain stimuli. However, another study conducted in Canada in 2018 found that men tend to remember previous pains more than women, making them more sensitive to new pain stimuli. William Shakespeare once said, "He who never feels a wound laughs at pain." This timeless quote reminds us that pain is an inevitable part of life, a universal experience that shapes who we are and how we perceive the world. Craving more science in your life? Tap a video, hit subscribe, and stay curious, where science meets the news every day, right here on BioSci News.